name is Samantha. I'm going to be your student nurse today. So I'm going to begin by raising your bed to 30 to 45 degrees, okay? All right, and I'm going to put this arm down before we go anywhere. Okay, so I'm going to get you to verify your name and date of birth. All right, it was correct. So I'm going to wash my hands and get some gloves. Okay, I'm going to place the gloves. Do you have any allergies that we need to know about before we get going? No? Okay. So your doctor has instructed me to insert an NG tube, which is a tube that will go through your nose, down your throat, and into your stomach. At any point, if you experience distress, discomfort, coughing, cyanosis, anything like that, or trouble speaking, we will remove the tube and go from there with your doctor, okay? All right, so I'm going to avoid the tube touching anything other than my gloves or the patient's nose. Okay, so I'm going to grab a piece of tape so that I'm ready. I'm going to measure the tip of the tube from the tip of the nose to the top of the ear, and then to the end of the xiphoid process. And here is where I will place that piece of tape to determine how deep we need to go. Okay, so again, avoiding it touching anything, explaining the procedure the entire way, explaining that if any discomfort, anything like that, we will remove it. So hold this over here, and we will place a towel on top of the patient to prevent anything, if any kind of spitting, anything like that, from getting on you, and as well as a basin. So I'm going to get a packet of lube, and I'm going to insert the tip of the tube 2 to 4 inches deep into the lube tube, provide a easy entry without any complications. So I'm going to hold one nair closed and ask him to breathe out. Hold the other nair closed and ask him to breathe out again. Which one was the easiest for you to breathe out of? Okay, that one is the one that we're going to use to insert the NG tube. It would be the easiest to insert without any kind of complication. So I'm going to ask you to tilt your head back. All right, now that his head is tilted back, I'm going to explain that I'm going to insert the tube. You will experience slight discomfort, but again, within any extreme discomfort, we will remove the tube and go from there with your doctor. So I'm going to begin the insertion. Okay, once it reaches his pharynx, I will ask him to go chin to chest, and I'll ask him to swallow as I continue to insert it. If ice chips or water is necessary, I will also provide that. So I'll go chin to chest, and then I will say swallow, swallow, swallow as I continue to insert it until we get all the way to this point. But that's as far as the mannequin will go. Okay, so now it's inserted completely. We will get a second piece of tape. We will rip a tail at the end of it. Whoops. We will place the widest unripped part on the patient's nose, and then wrap the tails around the tube. Okay, so it has been inserted, and now we are going to take you to X-ray to verify the placement of the tube before we do any kind of feeding. Okay, so the patient is back from X-ray and everything was correct. So we will remove the wire from the tube and do any kind of feeding that is also instructed by the doctor. Once he's ready to be removed, we will come back in, do hand hygiene, verify name and date of birth, and verify that it is to be removed today. So to remove it, we will remove the tape first. Okay. I will also place these again, just in case. There shouldn't be any kind of problem, but just in case. All right. So I'm going to ask him to hold his breath as I remove it to prevent any kind of aspiration, which would cause infections of his lungs. Okay, so I'm going to ask you to hold your breath, and it will be a quick process. You should not feel any form of distress or coughing or anything like that. Okay, so we're going to remove it. Hold your breath. Okay, it's removed, and we will discard the tube. We will remove all of these and make sure the patient's comfortable, make sure there was no any problems along the way, and then we will chart his response and his status in DocuCare. All right, and that is it.